You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, Dr. Clark Damon. Dr. Damon, welcome to the program.
Hi, Randy. Thanks for having me on.
Now, I know you brought a lot of photos, so we'll get to those. Now, for people that don't know your practice, who's the typical patient that comes in for dental implants?
We typically have two types of patients. One with bad teeth, bleeding gums, bad breath, people who are heading towards a denture. And then we have the other patients who are already in an existing denture. And those are the patients that are typically a little harder to get in because they're not seeing a dentist, right? They're just out living their lives with a denture.
Now, you don't like dentures.
You know, we provide lots of dentures for our patients, but yeah, a denture has a lot of limitations. Patients who have a denture, they have to change their habits, and they have to, when they go to a restaurant, they can't order what they want. They have to order what they can eat.
Okay, so no more dentures. I mean, is that the future of dentistry, where all dentures will be attached to something?
I sure hope so.
Or all teeth will be attached to something?
I sure hope so. I think that would really improve the lives of all patients.
So when I hear an ad or see an ad that says you can get a brand new set of teeth in one day, that's not an exaggeration. I mean, somebody watching this, if everything works out well, get some imaging, whatever, they can go in and maybe like in 2 appointments, and on the second appointment get their new teeth.
Yeah, you know, that's a common question.
I mean, that's what you teach?
Yes, that's
other
exactly what we teach.
Okay.
So it's a common question from patients. They come in, they say, I've heard about this, I don't believe it's true. You know, they all are skeptical, but yeah, every day we're providing permanent, fixed, same-day teeth in a day.
And that's what you teach. I mean, that's what this company has you on the road.
Yeah, that's the whole benefits of the All-on-4, which is teeth out, implants in, and a permanent, fixed set of teeth, all in that day.
Now, are there, back to the denture wearers, where you are in Texas, are there a lot of people wearing a denture?
Unfortunately, there are. So if you look at the statistics, 20% of all patients above 65 are wearing a denture. So in Texas, that's 500,000 people.
Wow.
If you look at the other statistic, people above 40, 10% of those patients have untreatable periodontal disease, meaning bad teeth, bleeding gums, bad breath. Those teeth can't be saved. They're heading towards a denture. So if you group those two groups together, you're looking at 1.5 million people in Texas alone who either have or will need a denture.
Now these people, because it's like a third set of teeth, right? I mean, they're considered permanent. Is that true?
Yeah, they are. They're permanently fixed and attached to the implants. They do not come in or out.
So if so many people, right, 1 million people have an upper lower denture or headed to dentures, why aren't they all coming in to do this with dental implants? What's your take?
Well, Randy, they simply don't know their options. So for a denture patient, the dentist is the last place they're gonna want to be.
Okay.
So if you think about the life of the denture patient, they have lost their teeth, but before that, they spent countless thousands of dollars trying to save their teeth. 40, 50 trips to the dentist maybe, root canals, crowns, all of that just is still, at the end of the day, they still lost their teeth. So for that denture patient, they're done.
So the last thing they want to do is go see you.
Correct. So they're happy. Denture is no more pain, no more teeth, no more problems. Okay. But they've now accommodated. They've now built their life around accommodating to that denture and to accommodating with no teeth. So when they go to the restaurant, they can't order what they want. They can order what they eat, what they can eat with.
Yeah. Yeah. Okay. And I know a couple of denture wearers. They never complained to me.
Yeah?
Are you saying there's no such thing as a happy denture wearer?
Well, I mean, Randy, you told me the story about your father.
Yeah, yeah.
You know, he was very happy and complacent with his lower denture and didn't even want to consider implants.
Yeah, he told me my dentures are fine.
The dentures are fine because he accommodated, right?
Yeah.
So he was happy with where he was, but then when he was introduced to dental implants and later got them...
I forced him to watch one of my shows.
Correct.
Now he has an upper and lower brand new set of teeth that don't come out.
Yeah, and so what has he said? Best decision he ever made?
And he said he should have done it many years ago. And people need to know, look, I'm not trying to endorse here, I'm just asking the questions. But yeah, my father, at 83 years old, has brand new upper and lower teeth, and he says he could chew through a door if he wanted to. And he says it didn't hurt, but he exaggerates about everything.
Well, no, that's true. A lot of my patients, we call them the day or two after, very minimal post-operative pain.
Okay, good. So you're big on sedation. So most people get like IV sedation?
Correct, yes. So everybody comes in, we give them a cocktail through the IV, and they wake up, and the procedure's all done. Yes.
Is it true some people don't even remember?
Just about, yeah. No.
With my father, he woke up on my sister's couch.
That's exactly what our patients say.
And so it's very little discomfort. And afterwards, how soon can they go back to work if they do work?
You know, we get calls from patients asking the day after, can I work out? Can I mow the yard? Can I go golfing? And those are all things we say yes to. In fact, I tell our patients, you know, the night after surgery, go have a hamburger, okay?
Is that right?
Yeah.
So they can eat. How soon after the procedure can they eat?
I mean, as long as they can eat, talk, and chew, then they can eat.
They're ready to go.
Yeah. So typically the night, maybe the morning after, something like that.
How old can you be to do this? Like the denture wear, or how old can you be to get a brand new set of teeth?
There's no age limit, Randy. We've got patients who are 80 years old plus getting this done.
Really? Why would an 80-year-old want to do this?
Well, that's the time in your life that you've earned it, right? You've worked your entire life, and now you get to go golfing with your buddies, and then you get to go to the coffee shop, hang out with your friends. So there's so many activities that are built around eating and social events when you're 70, 75, and 80 years old. So why continue to put this off? Why continue to live your life accommodating to your denture and having that make your choices for you?
So even at 80 or 70, you could do that same day procedure?
Yeah, totally. In fact, I would say that a patient who is 80 years old, who is in an existing denture, the procedure takes me about 45 minutes.
Is that right?
Some of these patients we can even do without a single incision. It's not for everybody, but some patients we can do without a single incision.
Okay, so no more dentures.
No more
Not
dentures.
in your practice. Because you originally bought a denture practice, right?
Correct, yeah. So the Fort Worth office was primarily a denture practice. We would do 30 dentures a month.
All right.
Nowadays, we may be doing 10 and replacing that with the same number of patients who are getting permanent, fixed, same-day teeth.
That's what everybody wants. Hey, you brought photos. What are we looking at over there?
First photo here is Daryl. So Daryl is a great guy. In fact, he's a chef at a local restaurant.
Okay.
Daryl wore upper and lower dentures. Okay, so no teeth. So imagine being a chef and being able to create all this wonderful food, but yeah, you can only eat the soft stuff. Okay.
All right.
So Daryl came into us hating his denture. So with one procedure in one day, we placed the implants and gave him a permanent set of fixed teeth. And so now look at his smile.
Very nice.
Look, Daryl is
looks like a different guy.
Happy, he's confident, okay? He has what he wants. And not only that, not only does he have function and can eat, but he looks pretty dang good.
He does. Yeah.
So, if you look at these teeth, look at how proportional they are to him. Look, that midline.
They look real.
They look real. And in fact, I would argue that they are.
Okay.
So,
and this guy can eat whatever he wants.
He can eat whatever he wants. Apples, steaks, walnuts.
Can he bite
chips.
things with the front of his teeth?
Front of the teeth.
Like on a carrot or something?
Denture patients, a lot of times they won't be able to contact or have their bite on their front teeth. Okay. Here, with this permanent set of teeth, every tooth touches. He can eat salads, apples, hamburgers, hot dogs, all of it. He can eat with his hands. He can eat.
Did they tell you this? I mean, do you hear a lot of eating stories?
Yeah, I mean.
Do you ever hear people afraid to eat? Like, Doc, is it too soon? Could I eat this or eat that?
The problem we have, Randy, is sometimes patients, they don't know what they can eat. So they call us and they're afraid. They think they're going to break something, and that's not the case. Randy, I've got another photo here. This is our patient, Paula.
All right.
Paula was facing tooth loss. Paula is a professional in the community, and as you can tell, her smile is a little less than perfect. Paula was suffering from really bad loose teeth. She had some bleeding gums, okay, and she really came to us to not only improve her teeth and function, but to improve her smile.
Okay.
So Paula was facing an option of a denture, and she didn't want that, so that's why she came to us.
All right.
So one afternoon, Paula comes in, sedate her, teeth out, implants in, and give her a permanent set of fixed teeth, same day.
Wow. And now she's a model.
Maybe
She looks like
not
a
a
model.
model.
She looks like a model.
Maybe not a model. She's a professional real estate agent in
Good.
the area. So she had a wonderful smile transformation. If you look at her case there, look at her lower lip. You know, right where her lower lip is, you see those upper teeth just contacting just really perfectly. That's because
So that's by design.
By design, it's custom. Okay, everything
Because it
here.
looks like veneers. Or I mean, it just looks like a great smile, I should say.
And that's my argument. I tell all patients who come in at consultation, you know, listen, we're going to give you teeth. We're not going to give you a denture. Okay, this is not a fixed denture. This is fixed teeth. So I definitely agree with that. You know, they can look pretty good. They can look like veneers or crowns. It's a smile makeover. So Randy, when we gave Paula her set of fixed teeth right after surgery, she was ecstatic. She really liked the way they looked.
I mean, when they look at the mirror,
we all did.
I mean, when they look at the mirror for the first time, what do they say?
Oh my gosh. They all say that. Oh my gosh. Thank you.
Is that right?
Thank you. Yes. I mean, look at her. Look at where she was before. Paula's one of our amazing transformations.
And this happens in one day. So they go in, extract the teeth, get a brand new set of teeth, and walk out.
Correct. Yes.
Is that right?
Yes. So typical surgery time for me is about 55 minutes. And so, you know, patients think this is a big major surgery. It's really not. It's fairly quick, simple, and easy.
But, you know, we interview dentists. I've been on the program. We've had the program for 20 years now. I've interviewed a lot of medical doctors, a lot of dentists. And most dentists do about one of these a month, right? On a national, probably average.
Correct.
You've done over 500 of these. And we were talking in the green room. I mean, you may have more experience than anyone that, you know, especially your age, but more experience than just about anybody doing this.
Yeah, we do between 10 and 12 of these a month. So, you know, 3 to 4 a week. So we're
Brand new teeth.
of brand new permanent implanted teeth. Yeah. So our practice is really dedicated to not only providing patients great smiles, but we really want to give them their lives back. Okay, let them have whatever they want to eat, chew, and then feel confident in.
Now, we should mention, at your center is a little bit different. I guess how it's normally done, dental implants, is you go to one doctor that does the surgery. Is that right?
Correct.
And then another doctor that puts the teeth on top, and then maybe somewhere else for the imaging, and then a lab is somewhere else. You do it all right there. So aside from convenience, what's the big benefit there?
Well, streamlined care.
Okay.
Right? So they'll come in, see us for consultation. They'll get an imaging done. We have a CT scanner in the office. And then we give them their options. So when the patient sits down with me or my associate, we will actually plan the case in front of them. They will get to see, you know, how much bone they have. They'll get to see, you know, the number of implants that they need. They'll get to see all of their options, and they'll get to see it planned in front of their eyes. So they know what the treatment entails, and they know that they're a candidate. In addition to that, the surgery happens in our facility. I do the surgery. And then when the patients wake up and in the post-operative period, we're managing the patients. So they only have to go to one office with one doctor, so it's really streamlined care.
Now, do doctors ever fly in to watch you do this?
We've had a couple doctors come in.
Because you lecture on this. I mean, for people just tuning in, I mean, you teach dentists across the country.
So one of the things that we do is I have an all-on-4 cadaver course that teaches doctors who want to implement this in their offices. Also with that, there's a mentoring program that goes in line with that as well. So we are training doctors in the office. Some surgeries they actually come watch, and we teach them how to do it. And some doctors will actually send us their own patients for us to do. And some doctors I'll even guide them and watch them do the procedure.
So is this the newest, hottest thing in dentistry? Like getting brand new teeth?
Every year we are doing more and more dental implants. It's really amazing. Patients are knowing that this is a very viable treatment option. And, you know, I mean, let's face it, if you're considering a denture or teeth, what do you think they're all going to choose?
Teeth.
They're all going to choose teeth. And so dental implants are really the way to go. Some of the newer modern technologies is really allowing us to provide teeth in a day. Okay, so
it's not lip service. I mean, you were actually doing teeth in a day.
yes,
Brand new teeth.
yeah, permanent set of fixed teeth.
Okay, good. We have time for some more photos. What else are we looking at?
This here's Tom.
Okay.
Tom's one of my movie star smiles.
Okay.
Tom's, we all of our cases look good, but Tom's is one that just really stands out. I've really enjoyed taking care of Tom. Tom had an upper denture, and he was very tired of it. And so he came in, we gave him a set of permanent fixed teeth in one day. His is actually one of these cases that we were able to do without a single incision. So healing for Tom was incredibly easy. So even though his surgery was really easy, and he healed very, very well, Randy, I want you to look at his smile. Look at how good that smile looks.
It does look natural.
So if you look at that upper lip, the midline is right there. The teeth are very proportional. They're masculine looking teeth. We've got nice pointy incisors.
Those are the canines, right?
Yeah, nice
So
pointy
you do
canines.
the pointy on purpose.
That shows a sign of youth.
Okay.
So older patients we may not want to do this for, but definitely younger patients, it is a sign of youth. And so it really kind of helps not only restore their smile, but really help give them an overall younger facial appearance.
Yeah, he looks good.
Yeah.
So they end up smiling more.
Tom smiles a lot.
Now, as a dentist, when you're walking around, can you spot people that are hiding their smile?
Totally.
Really?
Sometimes patients have mustaches that cover their entire smile. So on some of our patients, Randy's one of them.
Let's take a look.
Randy here had a really big, long mustache.
That's got to be unusual to have teeth like that.
For me in my practice, it's not. I would say Randy's our typical patient that we're helping. But these are patients who have hid their teeth. Randy's smile, I think, needed some help. Okay. And he wound up kind of hiding it a little bit with his mustache. So when Randy came to see us, he was looking at a denture.
Okay.
He was facing a denture. And that was unacceptable to him, which is why he came to us. And we offered him the permanent set of fixed teeth, upper and lower, all done in one day.
Wow, look at that photo. Nice.
This is actually Randy's smile immediately after surgery. So we're actually there in the surgery room.
It's not even this, it's like this, a different guy.
Yeah, I mean,
right?
look at his eyes. So right after right before we took this photo, Randy had his reveal. And he was he was overly excited about his smile and just really the way that his teeth looked.
And we've talked about this, especially a lot off camera in the green room, that people with bad teeth are judged. Like people make assumptions. And we talked about Hollywood. When you want to make a movie, if you want to make somebody look poor, or you want to make them look uneducated or a street person, you give them bad teeth, right? Even in cartoons, it's just what they do.
Yeah, no, I agree with you, Randy. People with bad teeth are judged. And, you take Randy's case here.
I mean, he definitely looks a lot more sophisticated in the after.
Yeah.
Like even more educated in the after. We've talked about this. I know it's a sensitive topic, but the guy is a complete transformation, and the walrus mustache is gone too.
Yeah, Randy's had his life change with dental implants.
Did they ever tell you that? Like, my life has changed?
They tell us that a lot, all the time. Let me show you this next patient.
All right.
Here's Robert. He found us online. He read all of our reviews and saw that we make patients happy. Robert was facing the challenge of what to do with his teeth. As you can tell, he needs some help. Okay. He had bad teeth, bad gums, bad breath, loose teeth. He had trouble eating, trouble smiling. He really wasn't at all confident or happy with his teeth.
Okay.
So Robert was facing either a denture or permanent fixed set of teeth. His current teeth were at the end of the rope.
Do they come in and actually say, look, like they find you online? Do they say, look, I want teeth that don't come out? I want...
Yeah.
I mean, are they actually asking for it like that?
A lot of times, by the time they find us, they've done their research or they've had another dentist only offer them a denture.
Okay.
They never offered them any type of implant solution. So they're looking for an implant center, which is how Robert found us.
Okay.
And interesting thing about Robert is he had to get ready for his daughter's wedding. And so not only was Robert having the trouble of some bad teeth, but he really wanted to look good for his daughter.
That's nice.
Yeah. So Robert came in, IV sedation, teeth out, implants in, permanent fixed set of teeth in one day.
Nice. Looks very nice. He looks a lot younger in the after too.
It really does look nice. You can see the light in his eyes. He's very happy with his decision. Those teeth really look like him. Again, if you look at the teeth, Robert's a male. We kind of want to do some more square teeth, and so I think it really pops. It really blends in with him, the teeth that we created for him. And his daughter's really happy too.
Okay.
So it was her wedding, and she wanted to make sure that her father looked good, and that he had some really nice permanent fixed teeth to really feel confident in. So as you can imagine, every time they look back at their wedding photos,
yeah,
she's going to be happy with the way her dad looks.
So he can eat whatever he wants, this guy.
He can eat whatever he wants. Apples, hamburgers, hot dogs, anything with his hands.
What about chewy things like a pizza or?
Pizza's great. I tell all denture patients, you can eat nothing by hand, okay? With a denture, you eat with hand and you bite it in, well, that denture's coming out with it. Not with permanent fit, not with
So you can just tear into food and pull it out of your mouth.
You can just tear into the food, pull it straight out.
So do you think if everybody knew, like if there was a weekend trial, like, hey, denture wearers, come in, try a brand new set of teeth for the weekend, nobody could go back to a denture after trying new teeth again? Would you feel that way?
I've never had a patient that we did implants on say, I wished I did not do it. They all tell me, Dr. Damon, I wish I would have done this sooner, and I'm so thankful I did it. In fact, a lot of our patients, if we just do a lower arch, they'll come back in a year and get the upper arch done.
But the upper arches are fine, aren't they? Because of the suction on the upper.
As long as you're not knocking that denture loose or laughing or eating anything, yeah, sure, that upper denture can stay in with a mound of adhesive, but it covers the whole palate, so taste is reduced.
Okay.
So with a permanent set of fixed teeth, it is just like you have your old set of teeth back. There's no palatal coverage, taste is better, function is wonderful. Like I said, patients can eat whatever they want. But really, it's the self-confidence booster that a lot of these patients get, knowing that their teeth aren't going to shift, move, or fall out.
You say, you were telling me on the phone that you see personality changes. That means you fix their teeth, and now they're not even, like they're different when they come in.
Totally.
Elaborate on that.
We've seen patients get better jobs. We've seen patients move up in their professional career. A lot of our patients that I see are really 45 to 50. Those are the patients who are actually, trying to get back into the dating scene. That is a huge thing. So they want to get back into the dating scene, make sure that their smile looks good, they feel confident. I had a patient, Billy, who we gave him a set of upper permanent fixed teeth. He now gets extra drinks at the bar, even from the bartender.
Just because of his teeth. So it like adds your charisma, I guess. They smile more, they're more approachable, that kind of a thing.
Yeah, imagine if you had to wear teeth. That is a totally different concept that a lot of patients don't think about, is having to get up in the morning and fix your teeth if you had a denture. It's not something that, a lot of patients think about, but it's a different mindset. So imagine if you don't have to worry about that anymore. You brush your set of permanent fixed implants just like you brush your old set of teeth.
Now we should mention, Medicare doesn't cover dental implants, Medicaid doesn't cover it, even the best insurance only covers a very small portion. So what's the answer?
The answer is financing. A lot of these patients come in, they're not writing a check for this.
Okay.
We are using third-party lenders to really help these patients.
So you have to have decent credit, but they're financing.
Yeah, decent credit. I will tell you that most of our patients are either teachers, hairdressers, barbers, plumbers.
Just we're everyday people.
Everyday people. That's what we're doing this.
And they finance it.
Yeah, they finance it. So they, our office kind of walks them through the process. So let me show you our next patient.
All right.
This is Alan. Alan kind of fits our typical patient.
Okay.
45. As you can tell, Alan's got lower teeth that are failing on him. He's got some pretty advanced periodontal disease, tooth decay, they're really not in good alignment. You know, Randy, look at that. He's biting on his back 2 teeth. That's him closed.
So he can't even close his mouth.
He can't even fully close his mouth. He has what in dentistry we call an anterior open bite. So in one day, in one procedure, we were able to give him a lower permanent set of teeth.
I mean, he looked happy on the before, but he looks really happier on the after, and it's changed his appearance.
Yeah, so we not only gave him teeth and a good smile and ability to eat and chew correctly, but look at his overall facial appearance. Before, he had a very long face, and it really looked kind of unnatural. But now we're able to change even his facial appearance and correct that lower third of the face and to make it more harmonious. So Alan's is a case that we're really happy about.
Okay.
So let me show you another one. So sometimes patients come in and they think that they're too old for dental implants. Here we got a guy who literally let his teeth go for 20 years. For 20 years he put this off. For 20 years he had pain, loose teeth, couldn't eat, couldn't chew, hid his smile, and came to us and we gave him a set of upper and lower permanent
nice.
fixed teeth all in a single afternoon. So no one is ever too old. You know what? In fact, what he tells me, I wish I would have done this years ago.
So everybody seems to say that.
That is a very common theme with our patients.
Because everybody puts things off, right? Especially the dentist. Nobody likes going to the dentist. Do you ever hear that, by the way?
Right.
No offense, doctor, but I don't like
Every single patient tells us that.
Is that right?
Yeah, but you know, and we understand and we know where that comes from. You know, a lot of times traditional dentistry has failed a lot of our patients. And so with dental implants, we're able to give our patients their teeth back.
We're out of time. So final message, somebody watching this, I guess the 2 categories, they're either wearing dentures or they are headed for dentures, really bad teeth. And they heard what you had to say, but for whatever reason, maybe they're skeptical, they're afraid. What do you say to them?
Just about every patient that walks in the door has some degree of skepticism on this. You know, either they don't have enough bone, or you can't do teeth in a day, or they're not a candidate. But we invite them in for a free consultation. They can come in, we can take a CT scan, sit down, and really go over their options with them.
So just find out your options.
Correct. Yeah.
Now, but isn't it true, and we didn't address this, but if you've been wearing a denture like 20 years, isn't it true you don't have enough bone to do this?
Not with today's modern implant techniques. Okay, I mean, every patient's a little bit different, and some patients need other things, but we have no bone solutions with zygoma implants, and just the technology nowadays really allows, it is almost unheard of in my practice that someone doesn't have enough bone or can't get this.
So you haven't had to turn anybody away and say, you know.
We have not had to turn anybody away. We have solutions for everyone.
Okay, good. I want to thank you for coming on the show. Great stuff.
Thanks, Randy. Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.